Did you know that every day over 800 women die from preventive causes relating to childbirth and pregnancy? This is very, very sad. And the majority of the deaths occurs in low-income countries, including Nigeria. Well, there is a simple and powerful measure known as prenatal care. And on this episode, we'll be discussing it in details. You're welcome to this episode of Earth 360, where we unravel secrets to helping you live a healthier and happier life. I am Blessing Oduni, and with me is my co-host
Solomon Ededo. Prenatal care, Blessing. When you start rolling out those data, you wonder like, wow, do we still have things like this going on? And it's not rocket science. What is prenatal care? It's all the care that a woman goes through from the time she conceives to the time she delivers. It includes various tests, examinations, consultation, advice, that is really, really necessary for the safety of both the mother and the child.
Wow, this is actually very, very profound. But then research also shows that women that do not partake in prenatal care, they are more likely to die from pregnancy complications and even childbirth complications, like over 3 to 4 times more than women that partake in prenatal care. So we see that this is very, very important. Even as mothers, as they expect their bundle of joy, there is also that part of being part of a community, going for tests, like you said earlier,
support system,
getting the right support, and also getting adequate information. Because there is something about information. If you don't know, you don't know. If you didn't day, it didn't day in quotes.
No shortcuts.
Local balance. So it's very, very important to partake in prenatal care and ensure that you take adequate steps. Also, it's not just for the mothers alone, even on the part of the child. Do you know that children that their mothers do not partake in prenatal care, they tend to die like 4 times over children that their mothers partake in prenatal care, like 4 times within the first year of existence. That's really alarming, and it's really sad because sometimes in this part of the world, in Africa, we just overlook these things and then it leads to several complications. So partaking in prenatal care helps to discover potential risk. It helps to discover and spot that, so there's a complication here, let's detect this, let's take this measure and ensure that the childbirth is safe and a success indeed.
So it is important that we achieve this success by ensuring that the women are empowered with not just the resources but the information. It may be as simple as how to lie down when you're pregnant in certain trimesters of the cycle, and people take some of these things for granted, but they are actually very important.
Very important. They
equip you with the nutrition, what to eat, what not to eat, how to go about some of the activities you go about. Of recent, I was just scrolling through YouTube, and it turns out there is a limit to the weight you can carry at certain stage of pregnancy. Some of those things are the information you get for free online. Some of them when you go for your consultation with these health practitioners for your prenatal care, they will give you these tips, they will give you these hints, they will give you tips on how to take care of yourself, how to take care of your baby, your unborn child, how to take care of them when they are born. So this data you are rolling out about children, their chances of dying in the first year being high, they're actually preventable, and the solution may be as simple as just an information. So it is very, very crucial that we don't take prenatal care, for granted. We don't take it with levity. I'm looking for the grammar.
All hands have to be
on deck. Yes.
So every pregnant woman around you needs to know that prenatal care is very, very important.
Even the community around, even their husbands need to know what to do. So when the woman is exhibiting certain symptoms, you know that this particular one, you need to quickly go to the health center for checkup.
And in these very, very beautiful times of our dear economy, it's funny that some of our dear women prefer to visit midwives and underground nurses. In our local plans, we say abele, like
those local international hospitals.
And really, you hear some cases, you're like, wow, why is this happening? And it has led to deaths.
Yeah.
Like deaths could have been prevented.
Preventable.
Which is very, very sad. And that's why we've come today on this episode to say that if you're a pregnant woman, you're an expectant woman, or even a father, and I know you love your wife so much, so do well to enroll and register her, or also ensure that everybody around you registers for this particular process, the prenatal care.
So both you, even husbands sometimes, go with them, get the information, because it's very possible that their mind goes off it. So it's possible that you also have it. So when they are doing things outside the bounds, you can quickly call them to order. So as we wrap up today, prenatal care is not just for the women that are pregnant to carry the body. It's for everybody. All of us need to know. Even when you are moving in the community and you see a pregnant woman that is doing what they are not supposed to be doing, or probably exhibiting certain symptoms, you can quickly call them. Please help us to save these incoming presidents by making sure that you do the right thing. So it's not just a one-person thing, it's a whole community thing, and most importantly for women to be able to support each other.
Yeah, that was really profound. Thank you. Thank you so much for joining us on today's episode of L360. We know that you found this episode very, very insightful. We know we are not even asking you. So do well to drop your beautiful comments. Do well to share this video with your family, friends, and loved ones, and even that pregnant woman in your sphere of influence. Thank you so much. I'm Blessing Odumini.
I'm Solomon. In case you have any question, you can actually drop it in the comment section. And on that note, we say bye-bye. Thank you for joining us today.
Until next time. Bye.